but we're excited about our governor's order today. But we also want to make sure that people who have often disregarded these guidelines hear again that staying in place, social distancing, staying at home, avoiding congregating together at any level is key for us to fight this virus. This is in partly true because many people who carry the virus are simply asymptomatic, and we can't always tell who may have the virus. Therefore, keeping a distance, staying out of large groups is fundamental for us limiting this disease. I fortunately work with a number of outstanding leaders. I'm terribly appreciative of Dr. Ray Watt's leadership as the chair of the board of our health system and the president of UAB, and Dr. Will Fernandy, who's the CEO of our health system and who's guided many parts of our clinical enterprise. Along with them, we have a number of unique experts in medical disease, but particularly infectious disease, who've become national spokespersons for this illness across the country. And they clearly have outlined that in this pandemic, our ability as a community, a state, and a nation to fight this is based on us following these principles of people not congregating, staying at a social distance of 6 feet apart, avoiding those areas where we know there's potentially virus spread, washing our hands for at least 20 seconds, disinfecting the surfaces and places where we find ourselves on a regular basis, and most importantly, staying at home as much as possible. For many, because of the experience that they may have in their local environment, they may not see this as serious. But we have colleagues across the country, but colleagues importantly here, who suffer and who are on the front lines. As I visited the ICUs at UAB, 30-some rooms with patients, the vast majority who are intubated and ventilated, and observing the healthcare workers putting their lives on the line daily helps me recognize that we, including me and all of those in this state and this county and this city, need to do our part. As they seek to prolong life and continue life for many of our citizens, our goal is to make sure we don't further burden the system. On a daily basis, we get new patients, and often on a similar number, we may see healthcare workers who may also be infected by this. It is both sad and troubling to see individuals who are seeking to do good also put themselves at risk. So it's even more important that we as a community recognize that the inconvenience that we may have to suffer through is for the betterment of patients and workers who are putting their lives on the line. Each day, the number of cases of virus infections grow. There are over 1 million people in the world, over 50,000 deaths, nearly 250,000 infections now in America. We lead the world in the number of infections, nearly 7,000 deaths. And in Alabama, we're close to 1,500. And we're certainly over 30 deaths that are associated with this. And in Jefferson County, we've been above 300 for some time, and I'm sure approaching 400 cases. This will not go away without our efforts to make this and follow these rules and take this seriously. So I thank you for both entertaining and listening what I've had to say, and hopefully we can make a difference by following the basic rules that we've put out and avoiding the gathering together, keeping a social distance, and being fastidious in how we wash and clean our environments and washing our hands. Thank you very much.
Thank you, Dr. Vickers. Now we're going to have Dr. Wilson from the Jefferson County Department of Health speak.
Good evening, everyone. I want to thank Governor Ivey for taking action today, very strong action. I also want to thank our State Health Officer, Scott Harris, for his support. I appreciate for both of them how difficult these decisions are to make. I've spent some time looking at the state order that was recently signed today. That state order does include a provision that the Jefferson County Health Officer is authorized to implement more stringent measures as local circumstances require after approval from the state health officer. Upon my initial review of the state order issued earlier today, I do see some areas that may require more stringent measures in Jefferson County based on our local circumstances. We have been in touch with our local hospitals, with the experts, as Dr. Vickers has mentioned, and we do think that we need to take every possible action to help flatten the curve and help protect our healthcare system. So we are spending more time reviewing today's order. We're being very careful and very deliberate, but it is highly likely that in the next 1 or 2 days, I will be seeking approval from the state health officer to issue more stringent shelter-in-place orders. Next, I'll introduce Dr. Jim Coker. Thank you very much.
So now Jim Coker from the Jefferson County EMA will speak.
Good evening, and thank you for taking time to listen to our important message today. I'd like to reiterate to everyone the seriousness of this event, COVID-19. This is both a national event and it is very much a local event. I'll repeat that, very much a local event. To that end, the orders that have been issued by the Jefferson County Department of Health and the Alabama Public Health Department can be enforced by local law enforcement, and we have communicated that to our law enforcement partners. Please take this seriously. Our lives depend on this. I would like to point you to some references, also some resources for you. One is the Jefferson County Department of Health website, jcdh.org, our own website, jeffcoema.org. Please look at ADPH and also the CDC as well. You have many people working for you to help keep you safe. That is a topic we'll discuss more this coming week. We've received many questions from people about how our partnerships work, and that is something we will share with you. But again, thank you for your time. Thank you for taking this seriously.
Thank you. I'm going to open up the line if we have any questions. We'll start with Dean Vickers. All right, the line is unmuted. Are there any questions for Dr. Vickers now that he's at the podium? While we wait, if there's any questions, I know that ABC 3340 sent one asking about hydroxychloroquine and if it's being given to doctors and nurses to prevent the virus.
So hydroxychloroquine is being used as part of our therapeutic options for taking care of patients. It is most importantly being used in clinical trials to determine its true benefit. And there are trials that we will be participating in that actually are involving healthcare workers, potentially given before they're exposed, but after they're exposed, in order to determine the full benefit. Can it prevent or does it actually treat? That's yet to be completely determined. So not at this time is it automatically given to physicians or healthcare workers, but it is as a part of the tool we use for treating patients.
Great, thank you. Does anybody on the line have a question for Dr. Vickers while he's here? Okay.
Hi, this is Swan with WBRC. We did have one question.
Yep.
We wanted to know, can he address testing and turnaround test times when it comes to people getting tested here in Jefferson County?
Yes, so testing has been a conundrum for our country and for our region. There are multiple people working to simply try to get testing done more broadly and testing done in a manner that gives turnaround times and improvement. I'll say two things. It's still a process of improvement, particularly for the community-based testing to get those around. But I eventually believe that will happen at a faster time period. Within the healthcare environment, we're fortunate enough that our scientists and our laboratory leaders and our hospital leaders have gotten to the level where for our patients and those individuals who come into the hospital and our healthcare providers, we can often get that time turn around in 24 hours or less. But that's not the broadest results for most people, and there's still work to be done to improve beyond the 5 to 7 days that people experience.
Great. Does anybody else on the line have a question for Dr. Vickers? I'm going to unmute y'all now. Anybody have a question for Dr. Vickers?
Sheila Smoot, Summit Media. I know they have that Facebook live. I don't know why they're doing that with the housing authority. Why is that in regards to the black community? I noticed that was that. But my main question is what is it? The social distancing piece, is it, even though it's 6 feet, they're really still not doing that. He needs to really kind of hone in on that for us.
So is your question, are you asking him about the Facebook Live tomorrow or about maintaining a 6 feet difference or within a group?
I want to ask him about the Facebook Live and why is it so important for the statewide shelter in place? Why is that? Yeah, that just happened with Governor Kay.
Yes, so I think it's an effort to make sure that every aspect of our community has a chance to hear and be given relevant information. I think one of the old sayings is when you think you've communicated, you need to probably do it 10 more times. And we realize that different parts of our community receive information from different components of our society. And so this effort for the Housing Authority is to make sure that individuals who might have a voice and have an opportunity to give information to a part of our community that may miss that, that's in part what we want to do. We want to make sure that that part of Birmingham and any part of the country actually gets that information. We also want to really avoid, which is occurring in other parts of the country, is that those areas, particularly in the Housing Authority, often are the areas that are suffering the most from this virus and often have the most difficult and worst outcomes. So we want to try to avoid and prevent that by information. Of the tools we have, it's our public behavior and it's the personal behavior that makes the biggest difference. Until we get broad, massive testing and until we get a easy over-the-counter drug to treat this, we have to use what seems a bit crude and unusual to make a difference in this. So Governor Ivey's order is important because it's the known tool we have to make a difference from the experience of countries that we've seen across the globe. Those who've done this have made some ability to bend this curve and stem this virus, and that's what we hope to do as well.
Thank you. I'm going to unmute this again. Does anybody else have a question for Dr. Vickers on the call? All right, if there are no more questions for Dr. Vickers, I'm going to welcome Dr. Wilson up to the podium. So questions now can be directed at Dr. Wilson when he gets settled. Are there any questions?
I have a question. This is Anna with AL.com. You mentioned that there could be stricter health orders in Jefferson County. What would that entail?
Yeah, there are a lot of details that we haven't addressed yet, and there's a lot of details in the current order from the state health officer that we have not yet reviewed. But there are some areas that I've been very concerned about for the last week or so, just observing behaviors in the community. And some of those areas of concern are some of our public parks where people are continuing to congregate. It's not true for all of them, but for some of them. Some mayors have already taken some action there, but that's an area that we're concerned about. Some of the big box stores and garden supply stores, we are concerned about those as well. So we're looking at that. We really want to emphasize that we only want people traveling out of the home, going to places unless it's really for things that they absolutely need to get along with life and to survive, and that's mainly food. There are hardware stores, building supply stores that we need access to so that people can do home repairs, fix the plumbing if a pipe breaks, things like that. But what we don't want to happen is a lot of people on a Saturday, the weather's nice, going to these places and congregating and just increasing the chances that people will come in contact with one another and spread the disease. And what we've seen in terms of behavior so far has concerned us. It's not everywhere, but we're getting reports from around the county and our surrounding counties that some people just aren't taking this seriously and are going out for unnecessary items that happen to be in some of those big box stores and some of the building supply stores, things like that. So those are just some of the areas. There may be more. Again, we're still reviewing that and we need some time, but we're going to do that as quickly as possible. If we see areas where we need to take action, we're going to move as fast as we can. I have been very concerned about the weekend coming up, that we would see more of these types of unsafe behaviors. And every day counts. Every day might cost a life. Thank you.
Are there any other questions for Dr. Wilson?
Yeah, this is Sheila Smoot, Summit Media. Dr. Wilson, are you concerned that people are coming in on Greyhound, Amtrak, coming through our airports? Could that be an influx of people coming in who are carrying this coronavirus, this COVID-19?
Yes, so certainly early on when we had a lot of things planned in Birmingham a few weeks ago, when I made my first recommendation to limit the size of gatherings and before my first order, that was a big concern because we did have some events planned. There's a lot less of that now, obviously, because most of those events are no longer allowed. But we do know there's some travel. We know there's a lot of local travel that's unnecessary. We cannot control all of that. But again, the emphasis on helping people understand, right now our message here locally is to stay home as much as possible.
Thanks. Any other questions for Dr. Wilson? Okay, if there are no other questions for Dr. Wilson, I'm going to welcome Jim Coker from the Jefferson County EMA back to the podium. Are there any questions for Jim Coker? The line is open. Does anyone have any questions?
One other question. I do want to ask about the mask and the gowns and the homemade masks. Can somebody address that, please?
Okay, we can do that in one moment. Is there any other question for Jim Coker? Okay, I think we are good on questions for you, Jim. Dr. Vickers or Dr. Wilson, would either of you want to comment on homemade masks and gowns?
About homemade?
Yes. Dr. Vickers is coming to the podium.
And scarves. They're also telling us to put scarves. How does that play into what we're talking about?
So just talking about homemade masks, scarves, and gowns.
So as it relates to the use in the hospital, for certain scenarios of working with patients who are known to be positive, the gowns and the masks need to meet fairly rigid criteria. And so in that setting, I think there's not the same benefit in use. I think if you're talking about in a personal environment where you're in the community, a barrier to both protect your respirations and aspirations as it relates to both your breathing as well as what you may take in, there may be a benefit from wearing a cloth or a homemade mask. The gown is a barrier if you're in some area or a surface where you think there is going to be a risk of picking up a virus. So that's how I would frame it. I think that there is a growing understanding that, particularly for shedding of the virus, that certainly one of the areas of highest concentration is in our throats and the back of our mouths, and in our pharynx, in our nose. So those are likely areas you'd like to limit spreading, even if you have no symptoms, because you might be a carrier.
Thank you, Dr. Vickers. Dr. Wilson is going to address this as well, and then that will conclude our questions.
Yes, I wanted to make an additional comment about some of the homemade masks and gowns. These are not FDA approved, and as was said, they are not suitable for direct patient care where there's a lot of very close contact. But there are many other uses, as already been mentioned. I would also like to say there are a lot of very good people doing excellent work in the community making these masks. And we really appreciate those efforts and their enthusiastic support of our healthcare workers and first responders and others. They're a very valuable asset in our community, and they're showing a lot of love for those first responders and people on the front line. We have already, as a health department, independently set up a collection site at Christian Service Mission, which has a big warehouse and a loading dock near Avondale, Birmingham, and that information is on our website. Additionally, we've been in touch with the people that are making these supplies and have learned a lot about what they're doing and the standards they're following, and we're quite impressed with a lot of the work going on. So we're working with them, and we'll be sending out other information in the near future about that. But I will tell you there's an area of concern that we have from a public health standpoint and protecting people. And in addition to our healthcare workers and our first responders, we have those situations where people are in very close contact, and sometimes they don't have a choice as to whether to be in close contact. Among those are our local jails, where we have people residing, inmates, and also workers that need protection. Or if there's someone who's sick, we need to be able to put a mask on that person to keep from having a major outbreak in our jails and further overburdening our healthcare system and costing lives. Another is our homeless shelters. We're very concerned about our homeless shelters. We're taking a lot of action as we speak to help our homeless population spread out and help the people who are experiencing homelessness be better protected as well, and those workers that are working closely with them. So we want to get some of these masks to them as well. There are many other situations that I've not mentioned, and we're trying to identify those situations, and we're asking those mask makers to produce as many as they can to supply all these different areas, including our healthcare workers, first responders, and others, because we're all in this together. Any place where we can prevent the spread of disease, we might save a life and help unburden our healthcare system.
Thank you, Dr. Wilson. And I'm going to give a closing remark if you want to come step over. Thank you. That's going to conclude today's news briefing. I do want to make a comment that we do have our helpbeatcovid19.org site up. UAB is using this to track hotspots and where symptoms, people's symptoms, and where there may be outbreaks in communities in our area and throughout the state. So please visit helpbeatcovid19.org every day, update your symptoms, and let us know how you're feeling. That'll conclude today's news briefing.